That hurts your back?
No, I'm usually just get nervous with it.
Isn't that crazy to be 20 years old and already having fear of moving your legs? It's not normal, right?
Whoa, that's really nice.
Isn't that cool?
I've been missing that one. Thanks.
All right, live from the Nerve Health Institute, we got Fee here today. This is visit number 2. And so she has back pain. And this is a common thing we see a lot in people with back pain, is they'll have one hamstring will be, the brain will set it, nerve memory, to a hamstring shorter than the other hamstring. And that causes a lot of problems. And so we have the ability with this technique we do to restore the nerve health to a muscle and make it longer instantaneously, oftentimes just within a few seconds. So we're gonna do that to her right now. I'm gonna show you where she is. This one kind of stops here. That's not painful. No, that's about as far as, she said she used to be, what, a cheerleader? So it used to be a lot more flexible than this. How old are you now?
20.
Yeah, so at 20 years old, we certainly want more flexibility here, right? Mm-hmm. But oftentimes 20-year-olds are students, just studying a lot, and wow, that hurts. Yeah, you can say.
Well, yeah.
Scale of 1 to 10, how bad does it hurt?
I would say 6.
Okay, in your back?
Yep.
Okay, all right. So we're gonna figure out where her nervous system lost power here. You can grip tight and try to reset it. Grip tight, please. There it is. See, when I touch that spot, isn't that cool?
Yeah.
I don't touch that spot, watch. Grip tight. I go touch that. Isn't that neat?
Yeah.
So watch, you're gonna put some power here. So you know what, we're gonna use a stronger light. We have all kinds of, you can let your leg relax here. So all nerves in the body are fiber optic. They need light. You're gonna hold that for me, yes. And I want you just to breathe. Okay, give me a little cough. Just a little, not a big one, just a little bitty cough. That's it. When you cough, do you feel your back pain more?
No.
There it goes. There it goes. What just happened? Isn't that cool? No cough. No cough. There it goes. Is that hurting? Feels good? Yeah. No cough. Okay, good.
Wow.
How cool is that?
Yay.
Does your back still hurt?
A little bit.
What did it go down to?
Definitely not as bad. It's like 4.
Okay. Isn't that cool?
Yeah.
So almost instantaneous results.
Right.
Maddie, you have any questions about this?
I don't, no.
Yeah. That hurt your back more when I go there?
A little bit.
Okay. So now you got more flexibility than the other side, like in seconds. So now watch how cool. So grip tight. See, when I touch, you're stronger now.
Oh, that's cool.
Isn't that neat? Yeah. So if I go to another spot, your brain still has power outage. Watch, it's probably going to be, just wiggle your jaw. Open your mouth and close. Bite down. That's not it either. Maybe shoulder up to your ear. That one.
This?
Uh-huh. And grip. Nope. Both shoulders. Nope. Pick your head up. Little cough. That's not it either. Good.
What about tapping on the jaw?
Yeah, that's what I was going.
Oh, nice.
Thank you, Maddie. Grip
You're
tight.
welcome.
Relax your jaw. Open your mouth. Just relax your jaw. Open your mouth now. Push your jaw this way. Jaw this way. Yeah. So the trigeminal nerve is not part of it. How about arm up straight and just do la-las. La 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 la. That one's good too. That's the vagus. Okay. So and you still. It's crazy. Yeah. Let me lower the other side out. Actually, it is. Now watch. Oh yeah, watch. That hurts your back?
No, I'm usually just get nervous with it.
Isn't that crazy to be 20 years old and already having fear of moving your legs? It's not normal, right? But do you have pain now?
Just a little bit.
This
like
arm up, let the other one go down. You're just going to test your nervous system. Little cough, please. We're increasing intrathecal pressure in the spinal cord. Pick your head up and making sure, look, cough. Yes, she's strong. I watch her just do a little cough. She stays strong. Oh. Little cough. Yep. Okay. Now we're going to stay here. Turn your head to the right. Cough. Turn your head to the left and cough. Oh, see, got it a little bit. All right. So beautiful. Okay. So come on and sit up. That hurt your back?
Not too much.
So when you stand up, you're going to feel taller and you're going to feel lighter on your feet. It's pretty cool.
Okay.
Is your back hurt now at all?
No.
Awesome. Okay, walk around and see what that feels like. You actually got a little taller. So when
Do you
you're,
think I can okay, there's this one thing that I do and it, whoa, that's really nice.
isn't that cool?
I've been missing that one. Thanks.
The little bitty things that we just take for granted that people have, and we can get rid of in minutes.
That's cool.
Welcome back to being 20.
Woo!
Stay tuned here for more results.